it's easy to be pessimistic because you see so many people get fatter and sicker, and you don't get the attention that you feel you deserve, or your family deserves at the medical businesses. But people's eyes are being opened, just like a tripper. You know how excited I was yesterday, even before I got that letter, of the response that I got from these physicians. And I know Dr. Esselstyn has had some positive responses, but to show a presentation like he did show just a few minutes ago to the doctors, they should have carried him out on a throne and brought him to the head of the administration and said, look, we're going to do this and not that anymore. It only makes sense. The reason it doesn't, the reason things don't get changed is just money. So these are not bad people. They're just like you and I, the same kind of people. It's just money drives everything. Well, anyway, let's go on to a presentation. I give presentations, new presentations all the time. I at least put together 4 new presentations a year. I'm probably getting too tired to do that anymore, but that's what I've done in the past. And thanks to Jeff and Sabrina Nelson, I get to come here and give these new presentations. The one I gave you yesterday was a presentation I've been giving probably since, well, certainly about 15 years. And the presentation I'm going to give you now is one I put together for our last advanced study weekend, which was in March of this year. September of this year. And Dr. Esselstyn is going to be a guest at our weekend, which will be in February of 2016, along with Colin Campbell and just a whole bunch of really neat speakers. And that's in Santa Rosa, California. Well, this presentation I put together for the last Advanced Study Weekend, which was just a few weeks ago. The weekends that we teach, and what we try and teach is we try and teach a good diet. And I also try to teach conservative medicine. There's so many things that are done that hurt people, and they obviously hurt people, such as heart surgery for chronic coronary artery disease, aggressive treatment of type 2 diabetes. I mean, this is just not a neutral therapy. These are killing therapies. And so in addition to recommending a good diet and inviting speakers that talk about good diet, like Dr. Esselstyn does, I also invite speakers that talk about conservative medical care like Dr. Esselstyn does. And many of the speakers that I bring in don't know anything about good diet. They're just there to tell you to not get a mastectomy or a mammogram or a PSA test, or to have coronary artery bypass surgery if you have chronic disease, and so on. Anyway, that's what we do on the weekends. In my April 2015 newsletter, one of the things that keeps me going, in fact, probably the only thing that really keeps me learning, is that I have set an obligation for myself to put out a newsletter every month, and I've done that since 1986. I have to tell you, the newsletter takes about 1 to 2 weeks to write, and I generally get started at the last minute. And that's how I write things. In my April 2015 newsletter, I talked about different types of diets and an extreme diet on one end. That extreme diet is the diet of the Eskimo. If you see the diet of the Eskimo is about 50% fat, 35% protein, and 15% carbohydrate. The Eskimo doesn't get energy from the protein in the meat that he or she eats. They get the energy, the fuel, from the fat. As a matter of fact, when you approach that protein level of 35% of the calories as protein, you get into a condition called rabbit starvation. People discovered this when they started living off very lean rabbits. The body actually started to fall apart with this much protein. People got sick, nauseated. And that's about the upper limit of protein that you can take in. The American diet's about 40% fat, 20% protein, about 40% carbohydrate. The diet I recommend, which is very similar to Dr. Esselstyn's diet, and the diet Dr. Ornish recommends, the diet Mr. Pritikin used to recommend, all pretty much the same kind of diets. It's about 8% fat, 12% protein, and 80% carbohydrate. Now, the other end of this extreme is something called the Kempner diet, which I'm going to talk to you about. This is the as opposite as you can get to a low-carb diet or a diet consumed by the Inuit Eskimos. And the Kempner diet is 5% fat, 5% protein, and 90% sugar, carbohydrate. So we're going to talk about some of these diets over the next few minutes. The reason I looked into the Inuit Eskimo diet, and Inuit is a preferred term by some people, Eskimo is an offensive term by some people, but Eskimo is the term that's used in the historical and the scientific literature to talk about these people of the far north. So I will use that term. It is a proper term. People who are on low-carb diets, diets like Atkins and Grain Brain and Wheat Belly, these ketogenic diets, they use the Eskimo as an example of how people can, no, not really can, but should live on an all-meat diet. So I felt it was necessary for the new book and also for a newsletter and a discussion for you folks to explore the Eskimo diet and see really what this is all about. Is it right to use people living at the extremes of the environment and barely surviving off that environment? Is it okay to use that as justification to eat low-carb, ketogenic, unhealthy diets? The Eskimo diet is high cholesterol, low calcium, high fat, low fiber, high protein, low vitamin C. They live off polar bears and seals and whales and fishes 10 months of the year. Then for a couple of months of the year, they have some berries that they pick, so they get a little bit of vegetable food during those months. People wonder how in the world can the Eskimo live off a diet of land animals and sea animals with virtually no plants. How can that happen? And they not go into ketosis like you would on a typical Atkins diet. What happens, or at least what the scientific literature conveyed to me, is that because the Eskimo consumes the animal right away in a fresh state and often raw, they get enough sugar from the glycogen present in the animal's muscles to keep them out of ketosis. Do you follow that? If you don't have any sugar, your body burns fat and you go into ketosis. Well, they just get enough sugar out of the fresh animal muscle to prevent them from going into ketosis. And the Eskimo isn't in ketosis because of that. It is exactly the opposite, of course, the kind of diet that we're recommending here. There is an apparent Eskimo paradox, and this is what you're taught. You're taught the Eskimo diet is a good diet because Eskimos have no heart disease, they have no cancer. That's what you're told, no heart disease, no cancer. And you're thinking to yourself, well, how in the world can a diet that's high in cholesterol, high in saturated fat, just, totally animals, not cause heart disease? How does that happen? Or is it true? Well, one of the mechanisms that's been invoked, and it was brought up here to me last night, is the idea that omega-3 fats, which are concentrated in cold water marine fish, prevent the Eskimo from having heart disease. And I think they do in part. They don't prevent them from having atherosclerosis, but what these omega-3 fats do is they thin the blood so that when a plaque ruptures inside of an artery, which leads to a blood clot or a thrombus, those omega-3 fats, they thin the blood enough so they may have less clinical heart disease, like heart attacks or strokes, sudden strokes. But it's the omega-3 fat that's been talked about as the key to preventing having artery disease and heart disease. Well, as far as a clinical state goes, and the presence of atherosclerosis, this has been reviewed, a thorough study published in Atherosclerosis, and it says, looking at the evidence of coronary artery disease, comparing non-Eskimos to Eskimo populations, they have a similar incidence of coronary artery disease. They have an excess in strokes, the Eskimo does, compared to the general population, the Danes that they compared them to. Overall mortality is twice as high in the Eskimo as compared to the Danes. And their life expectancy is approximately 10 years shorter. Articles I've read about the Eskimos describe them as young, strong, and fit, but rarely did they see a person over the age of 60. Now, these are traditional Eskimos, people who were studied, they weren't studied until about the mid-1800s. And so the earliest writings about the real Inuit Eskimo people describe them as looking well, appearing well, but not living very long. They did have atherosclerosis, extensive atherosclerosis, as reported in this study in 2003. But a more convincing bit of research that will surely tell you you can't get away with eating bears and seals and moose and fish and avoid damage to your coronary arteries comes from studies of Eskimos dating back 2,000 years. Mummifications in the cold tundra of that part of the earth, when people were buried, they were essentially in a frozen state. And so large parts of their bodies remained. And when they were dug up and examined either by autopsy or by CAT scan examination, they found extensive atherosclerosis in the arteries throughout the body of Eskimos. Hearts, kidneys, legs, brains, 2,000 years back. National Geographic did, here's some pictures of these calcifications. National Geographic did an article, it was in 1987. They published an article about two women who were in their cave, their ice cave, and the top collapsed and froze them in a tomb of ice for 500 years. They estimated one woman was in her 20s, another woman was in her 40s. Frozen in a tomb of ice for 500 years, they discovered them and they autopsied them, and what they found is both had severe atherosclerosis, in other words, hardened the arteries. And also both suffered from osteoporosis. Now, we won't get a chance to talk about this today, but those of you who followed my work, you do understand that osteoporosis is a consequence of eating animal foods. When you eat animal foods, you eat very high protein foods. These proteins dissolve into amino acids. The kinds of amino acids that are present in animal foods are very acidic. They're sulfur-containing amino acids, a high amount of sulfur-containing amino acids, which breaks into sulfuric acid. So this whole load of acid is dumped into the person's body. And the body has to neutralize this acid, and the way it does it is it dissolves the bones, and the bones release alkaline material. And that's how you get osteoporosis. And they could see it 500 years ago, back before pollution, back before modernization, extensive osteoporosis in these people. A study published on rather modern day Eskimos, this is 1974. They went to the part of the world where these people live, and they did bone mineral density tests on them to check to see how thick the bones were with minerals. And what they found is that the Eskimo, in every age category, had about 10 to 15% greater bone loss when compared to Caucasians in the US from eating all of that animal food. They made a statement, aging bone loss, which occurs in many populations, has an earlier onset and greater intensity in Eskimos. Nutritional factors of high protein, high nitrogen, high phosphorus, low calcium may be implicated. This is written in 1974. We've known for 60 years what causes osteoporosis. It's not something that just happens, it's because of the high intake of this acidic food, these animal foods. And the Eskimos are a good example. So here we have 3 strikes against the Eskimos. They don't live long. They have extensive artery disease, and they have weak bones. Eskimos are also infected with parasites, trichinella. About 12% of the population is infected with trichinella, which is a parasite found in mussels. You get trichinosis. You probably heard about getting it from pork. Fortunately, most of them aren't sick, but a few get sick from that infection. So being exposed to all of these animals results in another risk problem, and that is whatever diseases are in the food they eat, they catch. Eskimos are horribly polluted because they eat high on the food chain. It is high on the food chain as you get. Now, this pollution has only become a problem since the 70s. After World War II, we had a whole bunch of chemicals that were developed, pesticides, persistent organic pollutants, methyl mercury, all kinds of these environmental pollutants were put into our atmosphere, and they spread all over the world, through the air and through the oceans, and they get in the food chain, and because they're fat soluble, they go from the seaweed or the grasses and grains into the next animal, and then the animal eats that animal, and so on, and the human being who eats that animal. They bioaccumulate, and the concentration is biomagnified. Because the diet of people in this area of the world is still somewhat traditional, and they eat a lot of native foods like polar bears and walruses and seals and fish and so on. And in addition, they have the rich Western diet. These are among the most polluted people on the planet. As I told you yesterday, and the slide said so today, the breast milk and the body tissues of Inuit Eskimos are so full of these pollutants, they are classified as hazardous toxic waste. And Eskimo woman who breastfeeds her children delivers breast milk that has 5 to 10 times more organic pesticides and other pollutants in the milk than does a woman from southern Canada. So to use the Eskimo as an example of why you should eat a high meat diet, I think fails on every single point. And I didn't even get into whether or not they're constipated. But it would be a good question to ask, wouldn't it, since 70% of the people on the Atkins diet were reported to be constipated. We have a situation where the Eskimo, if you've been there, we're actually going to go back. It's going to be our second to next. Our next McDougall adventure trip will be to Kauai, Hawaii. And then next summer, we're going in June to Alaska. That'll be our third time to Alaska. The Alaska trip is all sold out. Don't even think about it. We have room on the Kauai trip. But you get a chance to see the people in Alaska, modern day people. And I have a chance to talk to doctors that work there and dentists who work there. And they may train, most of the time they've trained in the mainland and then gone to work in these outlying areas. And they report to me that these people are far sicker than the average American. More heart disease, more obesity, more diabetes, more alcoholism problems, more drug problems. I mean, really a sad situation. Your first thought might be, well, what we need to do is to put these people back on the native Alaskan diet. You know, go out and harvest the whales and the walruses and the seals and so on and get them back on that diet, because they didn't have those problems before modernization of about 35 years ago. I mean, they had osteoporosis and atherosclerosis, and they died young, but not the horrible problems they have today. You can't do that. You can't solve their problems by going back to the native diet. You know, a typical Eskimo today eats the typical American diet. They go fishing with a green lure. You know how you fish with a green lure? You get in your car, you drive down the street, you pull into the fast food restaurant drive-in, roll down your window, and you hand them a green lure. And they hand you back a fish. Anyway, and as a result, they're very sick. The only way you could improve the health of the people that are living in those lands now by returning to their native diet, you'd have to take them out of their SUVs. You'd have to have them go out and club and spear and hook their meals themselves over land. You'd have to put them back into igloos. Living in the modern environment that they live in, just like you and I live in, a warm environment, very protected. Going back on the native diet would just accelerate their problems. Wouldn't solve them. So what these people need to do, living in a warm environment like you and I do, is if they're going to be fixed in terms of health, they have to do the same thing that we recommend to everybody else. They need, even though it's not natural for them to be on a starch-based diet. You know, back when they lived in igloos and hunted their own food, you couldn't live on a starch-based diet. You know, it'd be too hard, you couldn't grow it, and it'd be too hard to, even if you could get it shipped up there, that's an awful lot of calories for them to consume. They consume 3,100 calories a day, typically, and as many as 7,000 calories a day. That's just is a physical barrier to survive in that type of cold environment. All right, so let's see. I did an article in my July 2015 newsletter on athletes. And what stimulated the article was I have 7 grandchildren, and my 3 oldest are grandsons, and they're just starting to get into sports. Ben, who's 9, he's out today playing soccer. And Jason, who's 11, he's gotten into long-distance running. And you know how you try and teach your children, it's really impossible to teach your children anything. Teaching your grandchildren isn't quite as hard. They don't get so defensive about what you have to say. And so since they were little, they've eaten the kind of diet that we recommend. And now that they're older and they get to make their own food choices, they have to be informed as to why they eat this kind of diet. Well, my oldest grandson, in addition to being involved in long-distance running now, he's also a big, big basketball fan. He could name every player in the leagues. And so I, in an effort to tell him how important it was to eat a good diet, I told him about a basketball player named Mark. He says, no, Grandpa, you say it, Gasol. I said, okay, Mark Gasol. And how Mark Gasol, who's, I guess, a pretty famous basketball player, certainly he knew him. He plays for the Memphis Grizzlies. He was out of commission because he wasn't playing well. And he spent 2 months on the bench. And then the big headline stories of, in July were how Mark Gasol's back out playing, hitting the hoop, doing really great. And it attributed to the fact that he has become, I think he uses the word vegetarian or vegan, pretty close anyways. That's what the article's about. Lost 20 pounds too. So that made an impression on my grandson Jason, and Ben, who's you got to run when you're playing soccer too. But there's other athletes who are trying to convince you otherwise. There's this fellow here, Sam, Inkinen. He's a triathlon competitor, and he just did, along with his wife, he just did a row. They built a special boat, and they rowed from San Francisco to Honolulu in record time in this boat, and they did it living on fat. Yeah, lived on just meat and fat. It was to prove that people can do well on these low-carb diets. There's a big push out there. There's to try and convince athletes to compete on these low-carb diets. You go through some type of major adaptation to this ketogenic producing diet to make you a super athlete. It's not true. But people are so impassioned by eating a diet that destroys health, planet, and animals that they have gone to an effort of telling people this is an ideal diet for athletes. Well, we know that worldwide, throughout all of human history, certainly for the last 12,000 years that we have pretty good records on, that battle fighting, athlete competing, people from around the world who live on starch-based diets. A good example of runners, which I told my grandson Jason about, who do very well on a starch-based diet, comes from the folks that live in Copper Canyon in northwest Mexico. They're called the Tarahumara Indians. Maybe Indian isn't the right word, Tarahumara people. And they, 30 years ago, it was reported that they would do kickball races, kickball events where they would run as many as 200 miles and run over day-long periods of time. And these people typically will run, men, women, and children, they'll run for 8-12 hours a day, just for sport. And their diet is a diet of beans and squash. 80% of the diet is made up by starch. They even have a new marathon, a 50-mile race that's called, that's the Spanish word, Ultrathon Cabello Blanco, that they run every year. They have them to recently what's happened in Copper Canyon is the drug cartels have so influenced this place that it's a dangerous place to go. The Copper Canyon is a difficult place to get to, and it's a good place for criminals to hide. These Tarahumara Indians, they've been studied. They were studied here in 1978. Their cholesterol and triglycerides were examined, and they were found to have cholesterol levels typically 125 and 120 milligrams per deciliter. They also, I don't know whether the next slide shows this or not, no it doesn't, but they were put on the American diet, and they showed that their cholesterol went up as expected when these Tarahumara people volunteered to eat a diet with more chicken and meat and so on. Their cholesterols went up as it would be expected. Now, some people may think that the Tarahumara Indian, this is a special thing, maybe because of their genetic background, but it's not. It's not. You can go back and look at studies of the people from Central America and Mexico and Southwest U.S., the native people, and you could see that they were all very healthy people living on starch-based diets up until recently. What happened recently to one group of these native people, it happened about 100 years ago, as they were put on a reservation around Phoenix, Arizona. And these people are known as the Pima Indians. The Pima Indians, they're the same genetic makeup as the Tarahumara. And if you've ever been to the Phoenix area, been to where these people live, once they were put on the reservation because the white man wanted to have a river that was going through their lands, and so you obviously know what happened is they took the river and put the native people on the reservation. They started feeding them the American diet, and now the the Pima Indians are some of the fattest, sickest people on the planet. Over 60% of them have diabetes, over 60% are obese. They have similar rates of gallbladder disease. They're just very, very, very fat, sick people because they're fed the food the U.S. government gives them. And their genetic identicals, the Tarahumara and the Copper Canyon, remain in phenomenal health with no heart disease, diabetes, or gallbladder disease. The Kenyans, I talked a little bit about the Kenyans. The Kenyan runners they have placed between number 1 and 4 in all long-distance athletic events since 1987. You know, I told you last night, someone told me in the Chicago Marathon, they took the top 3 places. I know the Boston Marathon, the winner, the female division was Kenyan. The Honolulu Marathon about 9 months ago was won by Kenyans. Ethiopians get in there and they win some of these races too. These people are known throughout the runner world as being phenomenal in their athletic abilities, especially to run and win these triathlons and marathons that people so prize. And their diet is a diet of basically corn and rice and potatoes. And so I tell my grandson, Jason, I said, you know, he's right now, I don't know how he did last night, but last week he was among 80 runners. He's 11 years old, among 80 runners, and he was number 20. And I know he's thinking now, what else can I do? And I know Grandpa told me about the Kenyans and the Tarahumara, so he's going to be really pushing the potatoes and the corn hard because he wants to win. There's some review articles like this one which look at high-carbohydrate diets or look at different kinds of diets to see which are best for athletes. And these kinds of studies have been going on for 80 years. And this is a good review study that shows clearly high-carbohydrate diets make winners. You can just take mouthwashes that are sugary and put them in an athlete's mouth while performing. And you see an enhancement of performance just from the sweet taste that goes in their mouth without any calories being consumed. Our body is set up to respond with energy and activity from carbohydrate, from sugar. Anyway, here's an excellent review article if you want to look at a broad base of science that's been done to determine what is the best diet for short-term and long-term athletes. The Canadian Dietitians Association, I think that's what this is from. Yeah, this is the Dietitians of Canada and American Sports Nutrition. They got together and put together a similar summary paper on what is the best diet for athletes, and the conclusion, as it should be, as it always has been, even though these low-carbers are trying to paint a different picture, is that you run best on the fuel that human beings have always lived on, a high-carb diet. All right, so the diet I recommend is a high-carb diet. It's the starch-based diet with fruits and vegetables. And I'll just show you, if you don't know already what starches are. You've had some excellent starch-based meals here already, I know. But, you know, this is what we eat. I was talking to Mary, just my wife, this morning, and even though she's out traveling today too, she said, I think I should probably put some beans in the crock pot for us for tonight. That's a typical meal we have. She'll cook various kinds of beans. There must be hundreds of kinds of beans, but I know in our pantry there are at least 25 different varieties of beans, and she just takes the crock pot out, throws whatever variety of beans and water together, cooks them, sends me down to the garden. I get some kale out of the garden. Not too much, remember the thallium. Plus our garden is grown with clean soil. Throw a little bit of kale, a little bit of leftover tomatoes that we have from our gardens this year. We had good gardens this year. And we'll have that along with some fresh baked whole wheat, no oil bread, or some rice. And sometimes she'll make it as simple as buying frozen rice, frozen brown rice. Comes in plastic bags, and she'll throw that in the microwave and heat it up. So the kind of meals that we have, I would guess Mary dedicates somewhere between 3 and 4 minutes to preparing them. And they're phenomenal. You throw a little sriracha sauce over the top, and that's typically how we eat. You know, sometimes we'll have sweet potatoes and broccoli. Our meals are quite simple, and they serve us well. And you should too. You know, when you think about your meal plan, especially those of you who are new to this, sometimes it becomes overwhelming. And it's not supposed to be. All these populations of people we've been talking about through the past, they've eaten the same thing 3 times, 4 times, 5 times a day. They have a starch in whatever fruit or vegetable is available. And you should do the same thing. You should pick a couple of things you like. And just have that every day, over and over again. Every day, our meals, every day Mary makes oatmeal, she puts blueberries on top. That's what we have every morning for breakfast. And then for lunch, we usually have leftovers, or as the man mentioned, Dr. McDougall's salty soups. They really aren't very salty. Their salt content is 480 milligrams compared to 1,400 milligrams for the typical raw men. But we'll have a soup or leftovers. That'll be our typical lunch. And for dinner, we'll have, you know, Mary will make a soup out of various vegetables and beans, or have sometimes corn. This squash. Mashed potatoes are, I know I have a picture of mashed potatoes, no. Mashed potatoes are one of the biggest hits that we have on our adventure trips. When we took people to Kona, Hawaii last year. I know Ann was there. Wasn't Ann and Larry? The mashed potatoes really went over well, didn't they? It was and this trip, I'm pounding on the chefs to do the same thing. We want lots of mashed potatoes, and they do sushi rolls, which also go over very well. I'll tell you, Anna, Larry, the array of foods they brought out, and the chef, his descriptions. He started describing to us what what the meals were, and it's almost like a song, the way the guy presents it. He loves it, and after he did that for Mary and I for the sample meals that we got, I asked him. Of course, he accepted with great enthusiasm and pride. I said, before every meal on our trip that we have coming up in January, I said, will you do this? And a big smile on his face. And you'll have some amazing stories on how he put together the foods. This is comfort food. Everybody likes this. Typical meal of ours, beans and rice. That's the way you ought to be thinking. It's very simple. The study we published in October of 2014 on 1,615 people, a great study. The results were an average weight loss of 3.1 pounds, unrestricted eating. That happened in 7 days. We included skinny people who needed to gain weight, and some did. And we included overweight people. No one was excluded, and the average weight loss was 3.1 pounds. Average cholesterol dropped 22 points. The decrease in blood pressure was 18 over 11 millimeters mercury in people with high blood pressure. And nearly 90% of people reduced or stopped entirely their blood pressure and or diabetic medication when they're type 2 diabetic. We also have some long-term results. I told you last night that we're having trouble getting them published because of industry's influence on the journals. They own the journals. Hopefully the Public Library of Science will publish our results, which have been done since 2013. We've been trying to get them published. And first thing we saw in the study, remember this is done independent of the McDougall program, Mary and I. All we did was educate the people. We had nothing to do with choosing the people to be in the study, nothing to do with collecting the data, and nothing to do with analyzing the data. And the first thing that they found, which really shocked them, is the people at Oregon Health and Science University told me so, that they didn't believe people would follow the McDougall diet. It was just too hard. It was just too unreasonable to ask them to do that. Well, the first thing that shocked them was when the data came out on compliance. This is food frequency questionnaire that we did. The red dots here represent the control group. Remember, this is a randomized, rater-blinded, controlled trial. So one group was asked to stay on the American diet. These are people with multiple sclerosis. And they did, by and large. You know, there was some contamination because they knew what the other group was doing, and they wanted to be well too. But they stayed at about 40% fat for the entire year. This is 1 year, okay? They stayed about 40% fat. We took them down to our clinic, gave them the typical McDougall education for 10 days. They dropped their fat intake down to less than 15% and maintained a total fat intake of less than 15% for a year. You ask, how many people follow the diet? The answer is 85% of the people followed the McDougall diet 100% of the time for 1 year. Now the reason is, is because the diet is what people like. There's nothing, it's the foods people want, and we properly taught them why, how to fix them. We showed them how to make them taste good by adding a little bit of salt and proper spicing, and to make sure it was a starch-centered diet. There was no reason not to follow it, because the foods, you know, are so enjoyable. You know, you will want to take and spice the foods the way you want, and only pick the ones that you want. We probably serve over 300 dishes in our 10-day program. And we tell people from the beginning, just find one dish you like. You know, one soup, just the minestrone soup or the pea soup. If you just took that recipe, which everybody loves, that's universally a great recipe, and you just go home and you make several pots of minestrone soup every week, and that's all you eat, is minestrone soup and water. You'll do phenomenal. You can make it even simpler than that. You can live on potatoes and water, or sweet potatoes and water. You can't live on grains and legumes and water because you're missing a little vitamin A and C, so you'd have to add a flowerette of broccoli or a slice of orange to get the A and C. But otherwise, make your diets very simple. Don't make a big deal out of this. Our weight loss results, so at the end of a year, were 20 pounds, about 20 pounds, maintained for at the end of a year. Now remember, these people they had multiple sclerosis. They were younger than our average group. Our average age is about 55. And these people were more about 35 years old. So they were younger, and they didn't come for weight loss. And they didn't pay their way there. We paid for them to come, our research foundation. Yet, these people who weren't generally, I mean, they were overweight, but not especially overweight. They maintained a 20-pound weight loss for a year. And this is the control group's cholesterol levels. As I say, I think they were a little contaminated by knowing what the intervention group was doing. So they dropped their total cholesterol by about 6 points. Bad cholesterol went down. Anyway, bad cholesterol's in blue. So it went down. Didn't go down much. 112 to 106. This is a control group. And then you see our intervention group, the cholesterol dropped, total cholesterol dropped 20 points. And the bad cholesterol went down, yeah. Anyway, that's what we showed at the end of a year. Okay, now I'm going to take you to the other extreme. We started with the low-carb diets and the example of the Inuit Eskimo being a living population that barely survives, by the way. It's a difficult life. They barely survive in that extreme of the environment. So don't get any impression that it's ideal. I want to take you to the other extreme, and that's the Kempner diet. I have several mentors in my life who taught me, opened my eyes and taught me the things that I know. Dennis Burkett. You can read about Dennis Burkett. My January 2013 newsletter is dedicated to Dennis Burkett, and has the only video that exists that I did on Dennis Burkett. It's an amazing piece. Nathan Pritikin was a huge influence on me, and my February 2013 newsletter is about Nathan Pritikin, and the only video that exists, which I did, is available for you to watch there. You can watch one of my other mentors, Roy Swank, who started the Diet and MS program many, many years, even before he headed the Department of Neurology at Oregon Health and Science University. You can read about him on my website and see videos of him. But there's one mentor I have no videos of and I have no pictures of that I want to talk to you about. He was the doctor that most influenced me in practicing medicine was Walter Kempner. And he influenced Nathan Pritikin and all kinds of other people. Walter Kempner did. And he had what is known as the rice diet. This is one of the only pictures that exists of Walter Kempner. Very private man. I was going to take my television crew down to Durham, North Carolina to film him. And his staff said, no, you can't do it because he will not allow any pictures. But Walter Kempner knew who I was because one of my books called McDougall's Medicine, A Challenging Second Opinion, I sent him a copy. And one of his patients, who was also my patient, came to me and said, you know, when I was at the rice program in Durham, North Carolina, Walter Kempner called me into his office. And he says, look at this book and look what this doctor wrote about me. He was so proud of what I wrote about him. He showed somebody else the book I sent him. Very private man. Came to Duke in 1934, 1939. He started the rice program. And the rice diet supported financially Duke University for 2 decades. Treated morbid obesity, has better results than bariatric surgery, better health. So he's published papers on treating morbid obesity with the rice diet. That was one of the more famous things that the rice diet was known for. But the rice diet treated lots of other things. For example, you could treat diabetic retinopathy. This is a picture of the retina of the eye with a lot of exudates, these white materials, and there's hemorrhages in here. Okay. This change in vasculature you can see by looking in the back of the eye, but this same disruption of circulation and damage and bleeding and so on occurs in every tissue in the body. The same thing is in the kidneys, all of the body. You just be able to see it in the eyes. So here's one of his patients with severe retinopathy, and here he is a few months later, actually a couple of years, and he reported on patients, 22 out of 44 of his patients showed these kinds of reversals of diabetic retinopathy. A guy named Van Eck did research independently at the same time showing that you could take diabetics and put them on a low-fat diet and reverse their diabetic retinopathy. And what do we do for our diabetics today? We do laser treatment, which is quite destructive. Maybe of some advantage, of course, but when we so simply, these people who are dying from vascular disease with diabetes, you just change their diet. Anyway, one other thing I want to tell you about this set of slides here. Walter Kempner was invited to speak for the American Medical Association in New York, and he accepted this invitation. He spoke in front of several hundred doctors in New York City and talked about his results, which, by the way, were all published before 1953. And he talked about his results and the phenomenal things that I'm showing you here and more that I'll show you. And at the end of the presentation, a doctor stood up and said to Walter Kempner about this slide, he said, "You reversed the order of the images." And Walter Kempner said, "I will never talk to doctors again." And he never did. He never did. There are days I feel that way. But I don't, and my triple experience confirms the fact that it is a solvable problem. Doctors are interested. As one of his little girls dying of kidney disease, extremely effective way of treating glomerulonephritis and other forms of kidney disease. You can stop the progression of kidney disease. This is all published. You go to my website under Hot Topics, you can read about the work that's been done on stopping kidney disease just with a healthy diet. We talked about reversal of artery disease. Dr. Esselstyn talked to you about, showed you some very impressive images about the circulation, PET scans and angiograms and so on. Well, Walter Kempner showed reversal of coronary artery disease before we had this technology. He did it with EKGs. EKGs, these are EKGs. What you have after the big spike here is you have what we call an ST depression, which indicates that the artery is blocked. And so Walter Kempner would do EKGs on his patient and show this ST depression, which is the swoop after the spike. And he would show that in half the patients, the ST depression went away. In other words, he showed before 1953 that you could reverse coronary artery disease. And of course, the chest pain and other problems of the patients likewise went away, but you actually could see it in the electrocardiograms, the reversal of the ischemia. People with heart failure, their hearts sometimes would be so swollen that it would the shadow would cover the entire chest x-ray. Half the people put on the rice diet had resolution of their cardiac failure. High blood pressure, I mean, he treated really high blood pressure. His patients had malignant hypertension, a hypertension that kills people with strokes and heart failure. And we didn't have any hypertensive drugs back then that were effective, and so what he would do is put them on the rice diet. He'd take patients with blood pressures of 220 to 240, the top number, and the bottom number 120 to 140, and he put them on the rice diet, and he cured 60% of the people with a simple dietary change. And I know, I would guess none of you have seen blood pressure that high. And a typical doctor won't see it that high either. The mamby-pamby blood pressure we treat is so easy to resolve with a good diet. Psoriasis, he showed that you could cure psoriasis. Not only did Kempner show that you could cure psoriasis, and also rheumatoid inflammatory arthritis. Somebody asked me about that. He showed that back before 1953 and published it. But Nathan Pritikin, who I knew personally, told me one time, he said, I have never seen a case of psoriasis, psoriatic arthritis, or rheumatoid arthritis that didn't dramatically improve or disappear with the dietary change we're talking about. And back then I was a young doctor, and I had a little skepticism when he said that. And I read about Walter Kempner's work. I had a little skepticism. Well, when I talked to Tripler a couple of days ago, you can tell this made a big impression on me, I said the same thing. I said, I've never seen a case of inflammatory arthritis. I didn't talk about psoriasis. But inflammatory arthritis didn't dramatically improve with the diet. I never have. And the doctors, instead of, standing up and walking out of the room and having unhappy faces or anything, they just sat and listened. Because it's true. All right, the Kempner diet is a diet of rice. They use white rice and fruit and fruit juice and sugar, table sugar. They had to give table sugar to cut the nutrient content of the rice. You see, rice has so much protein in it that it would burden failing kidneys and failing livers. So in some cases, Kempner had to make half the diet sugar, which has no protein, so that the patient would do okay, would not suffer from too much protein. A white rice was just about 5% protein. His naysayers, the people who wanted to see Kempner fail, actually took 8 of his patients who were on the rice diet, put them in a metabolic ward, and studied them, and reported they could find no metabolic deficiencies and only positive results on his patients. If you want to find this research easily, just by going to a link, you go to my December 2013 newsletter, and just what I said about his contemporaries trying to prove him wrong, just hit the link and you'll read the paper. Yeah. Anyway, that's the kind of diet that he fed him. Why did he use white rice? Because he thought it was more palatable and it was more convenient to get. You can read about Walter Kempner. One of his close associates for many years wrote a biography of him. It's well worth getting if you're interested in this subject. It talks about the man and about the things that he did. So the McDougall diet versus the rice diet, the Kempner diet. Well, one thing he did, he showed me, when I read his work, the power of diet therapy, and he also showed me that there's no possibility of developing any nutritional deficiencies based on the diet I recommended. After all, he recommended rice and sugar and fruit, and they couldn't prove any nutritional deficiencies. So all this nonsense about where do you get your protein, where do you get your calcium, all the things that people would worry about, even myself when I first started out, were proved to be nonsense by his work. Before I was born, in 1947, Kempner had disproven concepts that your doctors hold today to be true. Diet has little to do with heart disease. Many, if not most of your doctors still believe that, and Kempner proved that to be wrong before I was born. Additional protein improves health. I know almost all your doctors still believe that. Kempner proved that to be incorrect before I was born. And carbohydrates cause diabetes. He showed that his diet, which was 93% carbohydrate, cured type 2 diabetes 100% of the time. All this published before 1953. Well, I do use the Kempner diet sometimes. I still take care of real patients. I'm still a doctor. I take care of patients. And we usually have 40 to 50 people each program. And we run 6 programs for the public a year and 2 for businesses a year, our programs. And about 3 times a year, I have a patient who is so severely ill, primarily with kidney disease. They only have maybe 10, 15, 20% of their kidney function left, that I have to teach them the rice diet. I consider the rice diet the diet for the nearly dead, and that's how I use it. But the McDougall diet, what I teach, what Jeff and Sabrina Nelson have brought you together to learn, what Caldwell Esselstyn and Ann are trying to teach you. This is the diet for the living. There's no apology necessary. This is the best tasting diet, the least inexpensive diet, the diet that is most kind to animals and to the planet. There's just no reason to, in any way, question what you're doing once you know the truth. Well, ladies and gentlemen, it's been a pleasure spending a couple days with you. I need to catch a limo, catch a plane back to my lovely wife, Mary. And I hope you join us on our website. There's an extensive amount of information. We're doing live free webinars every week. Send out McDougall's Moments a couple times a week. Send out a free newsletter, which I'm working on right now. Well, not exactly. It's not. I'm thinking about it. But I do have to get to work on it. Thank you very much.